Hey guys, one of the biggest questions I get asked is who is the best person to put forward for an initial appointment? Okay. And I tend to use the generic term of entry point offer as the term to use when discussing initial appointments that are face to face, Zoom calls, initial phone calls that last longer than 5 minutes. Those are kind of like the umbrella term is entry point offer. Okay, so with that out of the way, I'm going to refer to entry point offer for all of these things because I don't want people to get confused that what I'm talking about only refers to Zoom appointments or only refers to face-to-face appointments, free or paid or whatever. Okay, let's not get in the weeds there. So entry point offers. Who is the best person to put in front of an entry point offer? Now, there you got you have three options, right? You typically have a refractive surgeon, they're in every practice, okay? You have an optometrist, they're in some practices, and you got the patient liaisons, they're in a few practices. So depending on who you have, you'll have a lot more optionality. But let's just talk about, assuming you have all three, okay? Which one would make sense? Because if you don't have all three yet, maybe you can get more, okay? So first thing is goal alignment. What is your goal? Are you trying to generate more leads or are you trying to generate more conversions? Because you will generate more leads if you offer an initial entry point offer with a refractive surgeon. That's because the value of that is just going to look better. Okay, it's just going to attract more people to want to do it. So that's the first step. Does that mean that you can't get leads without a surgeon being at the face of the entry point offer? Absolutely not. You can definitely get leads with conversations with patient liaisons and on orthoptists and or an optometrist, okay? Definitely, and we've done it many times. So you do not have to offer a refractive surgeon in order for this to work, but you will probably get more leads if you offer the refractive surgeon. Okay, so that's the first question, goal alignment, right? What's your goal? Number two, what problem are you trying to solve? Are you aiming to uncover an informational, a clinical, or a medical problem, right? Like, what are you trying to uncover? Which issue are you trying to deal with? You're not trying to deal with all those issues at once, right? You might have different appointments. For example, you might say, I'm going to have like three kicks at the can here. I'm going to have one informational, narrow problem solving solution, which is my entry point offer. I'm going to have a second entry point offer, which is my clinical problem solving solution, which is with an optometrist. And I'm going to have my medical consultation, which is aiming to solve the medical issues, okay? So you might have 1, 2, 3, and that might be a good way to do it, okay? And so you really have to understand what issue am I trying to uncover? What problem am I trying to identify in this situation? Because an informational problem, like for example, hey, tell me the pros and cons of refractive surgery, those aren't things that you need a medical doctor to answer. So if those are the kind of questions that you typically get, then maybe you gotta relegate those questions to a patient liaison. They're going to be better equipped and more, let's be honest, patient with those questions that they'll get 1,000 times. Okay, number three, which professional encapsulates the essence of your service the best, right? So if you have a person on your team who is just like amazing at customer service and that's your ethos, that's what you're trying to project, then that's the person that you should put forward, even if it's free, okay? If you're trying to project, medical expertise, then the person you should put forward is a refractive surgeon, okay? Now, that doesn't mean that you don't offer medical expertise because you offer a patient liaison to cover your initial assessments, right? That's not what we're talking about here. We're just saying, what are you trying to promote? What is the message you're trying to communicate? And you could have numerous messages. If the message is simply, hey, let me dispel some myths and some ignorance that exists in the marketplace about my particular procedure or the availability of a procedures you might not have heard of, well, maybe that is the job of a patient liaison. It doesn't have to be a surgeon, okay? The surgeon will simply confirm everything the patient liaison said anyway, as long as they're well trained. Okay, number four, who's the most available, right? So modern patient values convenience above everything else, right? So they're not going to wait for you if you decide that you want to offer an initial entry point offer, say 4 months out, 3 months out, 1 month out. I mean, no, that's just not going to happen. Imagine a store that only opens 1 hour a day, 3 weeks from now. That store is out of business. Okay, so what do you have to do? You have to get the person who offers the most availability. That sometimes is the most days, the most times, or the most ways of being in contact with, right? So if the person can do Zoom, great. If the person can do phone, great. If the person can do face-to-face, great. So those are the options. And you want to be able to deal with people on their own terms when they want to do it, and that's how you're going to get the most leads. Okay, number five, resource management, right? Which one costs you more? Now, obviously, the stock answer is always going to be the refractive surgeon always costs more. But do they? Because if you're early on and that refractive surgeon has a lot of availability, I want to put them to work to seeing initial appointments for free because I'm going to have the best chance of converting those initial appointments into surgical cases. And I will only start putting a patient liaison in that place once the demand for those appointments exceeds the supply available from that refractive surgeon. And when that equilibrium hits, then I better have a patient liaison or an optometrist to get and to fill that spot, because if I don't, then I'm going to be held back by the free work I'm doing compared to the paid work I'm doing, and I need to be doing paid work, okay? So that's important, resource management, right? But don't make that decision too early, because you don't want to scale before you've actually done the hard stuff, okay? That is your competitive advantage. To be able to offer surgical appointments for free is not like, oh wow, are you desperate? Isn't it terrible that you can't charge for your fees? Are you crappy? No, don't think that. Patients want value, right? And they'll definitely want a free appointment with a surgeon more than they'll want a paid appointment with a surgeon, okay? So that's resource management. First impressions, that's number 6, okay? Number 6. It's simple. So is your patient's initial experience, that's going to dictate their perception for everything that comes after. So do not just put somebody like a leftover or somebody that doesn't have another good job. Put the best person at your entry point offer, right? The best person who can deliver an excellent patient experience. Because if you don't do that, your prospective patients will judge the value of your paid services on the quality of your free services. So you do not want to shortchange that, right? You really want to offer the best free experience you possibly can. And sometimes that's putting the right person to the job, and sometimes that's the high paid person, okay? And that doesn't necessarily mean a surgeon or optometrist, but the high paid patient liaison, okay, who's really worth it. And like, they're worth their weight in gold if you got the right one. Okay, who's a conversion pro? So who's got that magic? Who's got that ability to get people enthused and excited about the whole process, okay? Because what you need to have, especially with cold audiences, people who don't know you so well, is you're going to have to be able to excite them with an aha moment, right? An aha moment is, wow, this is incredible. I'm amazed at what I can achieve. And B, right, it's the ha, which is ah and the ha. The ha is, I understand. I get it. I know what to do next. I know how to get this thing, okay? So that's the person you want to make sure that is being able to do that, because that's how you're going to get most conversions. And then lastly, number eight is the power of the CTA, okay? So the call to action. You are not going to get many conversions if that person who is at the appointment for the entry point offer is not very disciplined in only sharing sufficient information that will solve the narrow problem that patient came in for, no more, but solve that narrow problem. So if it's an informational problem, they solve that informational problem. And once that informational problem is solved for that prospective patient and they know it, they've gotten the value, then the call to action has to happen. And if that call to action doesn't happen, you will not get conversions. And if you don't get conversions, there's no point in doing the entry point offer. Okay, that's the point of the entry point offer, is to generate conversions. So with that, the post that accompanies this, the information that accompanies this, will give you all the 8 steps to thinking about. But your decision is yours. You have to make it for your own. And I also encourage you to think that whatever decision you make now, it's not that it's not reversible, right? This is a reversible decision, so it should be easy. Just choose the one that makes the most sense now, and then be ready to change and pivot your approach every 90 days. What will make sense then? And you'll know, okay? Because again, you take it through the framework, you understand these 8 considerations, what makes sense now, okay? So the advice that you hear today might not be the advice you want to act on tomorrow. But if you, with the right framework, with the right considerations to ponder, then you're able to make the right decision when it makes sense for you, okay, in the future and now. Okay, thanks very much, guys. I hope that's been helpful. If you have any questions, you know how to get me. Bye for now.